What will try to increase? Huh? Compensatory mechanism, heart rate will be high, stroke volume will be high. Normally shock is tachycardia, isn't it? Normal response is a tachycardia until unless the heart is gone, heart is unable to pump. So heart rate, cardiac output, everything will be higher. Okay. Main problem in distributed shock is here. It will dilate. Okay. What will happen to the SVR? SVR low. This is only shock. So SVR will be low. So what will happen to the venous pressure? Because this is the dilated area, peripheral vasodilatation. So venous pressure, because the blood will be pulled there. So the actual venous pressure here will be low. Okay, because here it dilates like this. So it will be the blood will be pulled here. So the actual venous return or pressure will be low. Okay, and what will happen to the MVO2? Mixed venous oxygen saturation. This is a tricky question. What will happen to the mixed venous oxygen saturation in septic shock? Actually, the extraction is very low. Okay, the extraction, because in septic shock or distributed shock there is arteriovenous shunting also here. Yeah. Okay. So there is not effective extraction of the oxygen by the tissues. So the leftover oxygen is more. If I can't
along with this, as per
adequate
the
food from the plate or the dish,
we have
the leftover
the
food will be
clinical
more.
aspects of
Similarly,
microbiology
here. Because of the problem in the
that
microcirculation,
selectively
it can't extract
includes
much oxygen.
the
So the
pandemic
leftover oxygen
module
will be more. So the mixed venous oxygen
and
saturation will be
the clinical aspect like
okay. So this is the basics.
antibiotic stewardship
Okay.
and antibiotic protocol.
And now,
So to start with,
you must remember that
this is an
shock is a
introductory
very,
class,
has a spectrum. Shock has a
and
spectrum.
I will tell you
Sometimes it's very easy to diagnose.
the history
sometimes
of
it's very difficult
microbiology
to diagnose. If the
and the
all the
importance of
fluid signs and symptoms are there,
microbiology reading.
anyone can diagnose shock. Patient is hypotensive, patient is tachypneic, tachycardic.
Practically, you have entered
no
the world of
anoric.
drug
Everyone can
resistance.
diagnose. Even the guard will also able to diagnose. Sorry, it's a shock.
In our times,
Huh?
it was
But
very easy to treat
it's not easy to
microorganisms.
diagnose
Antibiotic
shock.
is really difficult for the clinician.
That time, you have to be very
The
careful.
drug-resistant strain has
You can
emerged.
diagnose only you do the metabolic.
The
monitoring.
drug-resistant virus,
Now, if I
the
ask you this
drug-resistant
question,
fungi,
circulation has, this is a
And
macro circulation,
the immunology in our clinical practice.
marker of
Which
how
drug
do we
to select?
assess macro circulation.
How to prescribe?
Common sense.
What will be
physiology.
the dose? Is really difficult.
Huh?
Lot of things arterial
Pressure, blood pressure. That's a
The MIC value
normally non-invasive.
known as
Normally,
minimum
blood pressure is
inhibitory
non-invasive
concentration.
but actually it's an arterial
The
pressure.
minimum
mean
bactericidal
arterial
concentration.
pressure. আমরা যখনই এইসব ডাক্তারি
The
কথা
different
বলি medical sciences, so we always use the term mean arterial
indicators
pressure. So macro circulation এর marker
and the
হচ্ছে
different clinical
mean
parameters
arterial pressure.
are assessed.
Okay. And who is the marker of the microcirculation?
Being a
How do you assess
microbiologist,
the microcirculation is
It is
correct or
really
not?
difficult to assess which one is commensal,
Microcirculation?
which one is the normal flora of your system, and which one is pathogen.
No. Microcirculation means
To differentiate
blood has been pumped
the
out
normal
here,
flora
okay.
with pathogen.
Arteriovenous
is
thing,
big challenge.
everything. Oxygen has gone
When
to
you're
the
taking
cell.
a swab
That's
from
the
your throat.
microcirculation. Cell is getting adequately perfused.
Safe
from
throat.
Aerobic to
So how will you
anaerobic.
assess
What is the
that
end product
particular
of anaerobic
streptococcus is the
metabolism?
causative agent,
Lactic acid. So
or
if
that
the
streptococcus
microcirculation
is
is
the
not
culprit?
they think is at fault.
So the
it will produce
differentiation is bit
lactic
difficult,
acid. So if you measure lactate in the blood,
and this is the
you can
important thing
assess
of
the
microbiology.
microcirculation is working on
How
it. Okay.
will you assess
So this is the
that this particular organism
marker
is
of
the
this
causative agent or
map
culprit?
of the macrocirculation, and microcirculation
The
of
different
the metabolic
flora
marker will be
of your
lactic
intestine.
acid. Okay.
The different flora of the oral cavity.
So that's why the subtle
Are mixed.
shock will be diagnosed with
Multiple
metabolic
organisms are
quantity.
there.
Now shock has different stage. Shock is an
From your culture isolate,
in the
here lies the key.
compensated shock. What will happen? Compensated shock. What will
To
happen?
differentiate a particular
Body will
area
try to preserve blood to the important
is very
installations.
important.
What are
From
the
where
important
the material
installations in the
is
body? Brain.
if it is from throat,
lungs,
The possibilities are
kidney,
Streptococcus,
heart definitely, heart is the
Staphylococcus,
organ is pumping
and
everywhere.
Corynebacterium
So he'll try
diphtheria.
to, heart is pumping, heart will try to
Forget
pump blood
all
or
other
supply
organisms.
blood, oxygen to
If not
brain, lung, kidney. This is the
If the swab
important
is
organ.
from back,
Every organ is important. It's not
From
like the
back
skin is
also.
important. Every organ is
the
important. but
possibilities
among
are
them,
Mycobacterium
they are more vital.
tuberculosis,
Okay.
atypical
Because skin
Mycobacterium,
and